Good to see you.
Good to see you too. Happy Saturday.
Happy Saturday. Thank you. I know I have some people who are jumping on in a few moments and then people who are going to catch the replay. But it's so good to see you. And I'm just so appreciative of your willingness to come on. I know you are busy. You're a world traveler. So, I'm always looking to see where
Oh
you
my
are.
goodness. Craziness. Craziness
Yes.
has been.
Yes, but when I was thinking about March and Women's History Month and the space that the Scene Society does, which is connect inclusivity in the workplace to build spaces where people with invisible and chronic illnesses can thrive, I really wanted to think about this. We always hear about women who were fighting for a seat at the table, and a lot of us are in that space, but I also wanted to lift up women who have been trailblazers and went and created a table to empower others and increase inclusivity. And I felt like there was no one else. You had to be in that in
Oh,
that space.
thank
And
you.
so
Thank you.
we have people coming on, and so please tell everyone. I would do your introduction, but I would love for you to tell everyone who you are, tell them about gut theory, and then why you became a gastroenterologist.
All right. Thank you. Thank you for having me and for that intro. Good to see you too. Let's see. Where do I start in this craziness? My name is Janese Laster, originally from Birmingham, Alabama. Let's see, college in Atlanta at Spelman, and then medical school in Texas, and then residency and fellowship here in DC at Georgetown. And during that training was really when I started to really get to understand sort of chronic disease and understand that sort of our medical system is really, really good at teaching residents and fellows how to treat things that have already happened, so secondary prevention, but we're not real good at that primary thing and having those
Mhm.
conversations. So we had a patient with a lot of symptoms, they all had high blood pressure, diabetes, high cholesterol, fatty liver disease, all of these things. We were just, able to give medications, or they had, inflammatory bowel disease or Crohn's, and patients were asking these questions about nutrition and what else they could do aside from medications and procedures. And sometimes I didn't have an answer for that because it's not something we were being taught. And so I really sort of went down this sort of rabbit hole of trying to determine what else can I be offering patients besides doing procedures, or in addition to doing procedures. Ended up doing a nutrition fellowship so that I can understand sort of what was happening and why patients were developing these diseases, and what we could do to intervene. And
Mhm.
then ended up finding a mentor at Brigham and Women's in Boston to do a rotation with him, because he did all of these really cool, innovative bariatric procedures that were less invasive. And then got obesity medicine board certified and ended up going to Spain to train further to learn to do those procedures. And as I was determining what my life was, what I was going to do with all of this extra training, and interviewing for jobs at hospitals and practices, I recognized that I just didn't fit anywhere. I didn't fit in what sort of traditional medicine wanted, and I was like, okay, what am I going to do then? Because I don't want to do these things. I know what I want to do now.
Mhm.
And so I started my own practice, and because I wanted to be able to kind of bridge that gap that I saw was there for patients, which was not understanding sort of why their body felt the way that it did, not understanding the food they were putting into their body, not understanding why they couldn't lose the weight, why they had chronic constipation or diarrhea or heartburn or any of those things. And so that is sort of when my practice started. And I love to be able to spend that time with patients, understand and help patients understand and find that journey of what causes them to have symptoms, how stress relates to their bodies, how eating particular foods, and sort of getting them out of habits, because a lot of these things are habits,
Mhm.
and showing patients about eating healthy does not have to be boring. It doesn't have to be hard. You don't have to be rich, and sort of breaking a lot of those myths. And, it also doesn't have to be that you can never lose weight again or you're always going to regain the weight. And so showing patients those things, what has really been really fun to be able to do the sort of the entire spectrum of offering sort of counseling and education, offering medications when necessary, but also procedures for patients that maybe need that. And being able to explain all of those things to patients in a way that is not biased, but giving them their options, because everybody's somewhere different, and being able to explain what excess weight and obesity is as a chronic disease, and how so many other chronic diseases sort of span from that. So yeah, that's me in a sort of quick
Yes.
nutshell.
Well, I'm a native of Texas, and I didn't realize you did time there. And so,
Hmm.
like,
You're
what?
right. Did time,
Yeah, not did
Texas.
time, did
It
educational
feels
time.
like did time. Yes, Texas. It's an interesting place, that's for
I
sure.
know. And so, but your experience, I love how you said you didn't fit anywhere. And I think oftentimes when we're going through this and we have a goal and we're working towards it and we're like almost there and we realize, like, wait, like I thought this was what I wanted, but actually I don't fit in this space and I want to expand it. So many people get discouraged at that moment or think, oh, I did the wrong thing, or I made a mistake, or but depending on your faith, did I hear the right thing from God? Did I hear the right thing? And I think in that moment, it's like if you were created to not fit in that space on purpose because you had this bigger platform to build. And I'm so glad that you leaned into that, because there are patients like me. I'm not one of your patients yet because of location, right? But you would absolutely be my doctor if I lived in the area. But there were people who needed you and needed you to show up. And so thank you
Yeah.
for showing up. Just to level set, because I don't know everybody who is on the call and who are watching or who may watch this. Can you just briefly explain what a gastroenterologist
Oh yeah.
is and does? And then we'll go to our other questions.
All right. Perfect. So gastroenterologist, so people who don't understand, when you go through your training, you go through residency first, which is kind of a general training, and then people can subspecialize. And gastroenterologist is a type of subspecialist. And when you think of gastroenterology, just think of the gastrointestinal tract. So everything from the mouth to the anus is sort of our fields, in addition to like the liver and the gallbladder and the pancreas. And we sort of, if a patient has heartburn or abdominal pain or nausea, vomiting, bloating, constipation, diarrhea, blood in the stool, gallstone issues, pancreas issues, liver issues, these are our subset of patients. The doctors that do upper endoscopy, so a scope that goes into your mouth to look into your stomach, a procedure, or colonoscopies, which more people have heard of, and that is a preventative procedure looking for colon cancer, to remove polyps so that it does not turn into cancer. And also in patients who have inflammatory bowel disease, it's a diagnostic tool. So we can take biopsies to look for inflammation, or if it's somebody with other types of diseases, something like microscopic colitis, it allows us to diagnose that. Or sometimes patients will have narrowing of the colon and we can, put a stent in to open that back up. So it's sort of the non-invasive procedures that we do, or advanced endoscopists will do what are called ERCP to take stones out of the bile ducts. Or I also do other advanced procedures called endoscopic sleeve gastroplasty. So it's suturing the inside of the stomach to create a smaller stomach, or placing a balloon in the stomach to sort of help with reducing gastric emptying and weight loss. So there's a lot of procedures that we do that are, the whole purpose of our field was to do things sort of less invasively than it's having to undergo surgery. So typically after one of our procedures, you get up and you go home the same day. And that is sort of what a gastroenterologist is.
Thank you. Thank you for that.
Yeah.
And I know when you and I talked about this, we talked about wanting to know about your practice, but also your experiences as a Black woman navigating the medical field. So you talked about some of your patient experiences and things you were seeing that led you to start Gut Theory and what how you wanted to impact patients. What were some experiences just for you, just in the medical field, like that happened to you personally? If you can share any of those that also pushed you towards opening your own practice and wanting to expand what you do based off of your lived experience and the lived experiences of other Black, Indigenous people of color that you were seeing.
Yeah. I I felt there were a lot of patients that we didn't have a lot of time. That was one thing that was a little frustrating. So most patients will tell you they wait 4, 5, 6 months to be able to see a gastroenterologist. And by the time they come to see us, when I was in a hospital setting, we could see them I mean, like the slots were literally slated for 15, 20 minutes. And if you took the amount of time that you really need, like I take an hour with my patients now, but if you did it that all day, you would never leave the hospital, and every patient would be pissed because you would be so behind all day long. So um, it was trying to stay within those little increments, but you can't get really to the root of much during that time, right? So
Mm-hmm.
that was a little frustrating because you saw these patients and you knew there was more that needed to be discussed, but you really didn't have the time to do it. So that was frustrating to see patients go through that and to know that there was probably more I could have done, but simply not having enough time to do it. And then it was also watching people not get better, just sort of adding a different medication every single time and not really, them not really understanding, having enough time to really go through the disease process, why it happens the way it happens, how the medication works. And I find now when you're able to educate people on something as simple as heartburn, and talking about the pathophysiology of it, why it happens the way it happens, how the medication works, why instances where you may not need medication and what you could do about that. If when you explain it to patients, then it makes them think about it a little bit more when they're about to do certain things. And they're like, oh yeah, that makes sense because if I do X, then it's going to lead to this. Let me not do that anymore. And so when you don't have that time, it's just sort of, that's why patients a lot of the times feel like doctors are just like, we give people handouts because we don't have time, but then most people aren't reading those handouts or they don't understand the handouts.
Mm-hmm.
And so that was frustrating. But also seeing people just like they were falling through cracks left and right. Because there was not a lot of follow-up, people not understanding sort of how to navigate the medical system. So maybe you say, all right, I see you're having this problem with bowel movements. I'm going to send you to a physical therapist to help with whatever. But you don't know I give you such paper and tell you to call this number, but then you don't know what to say when you call, so it's just all of these little things that people were just falling through cracks, it felt like, and not being able to navigate the medical system. So that was something for me that was frustrating to see that it was so many people that every single visit they gain a little bit more weight and every single, and it was just a little bit more and a little bit more. And we know what's going to happen. Then it's fatty liver, then it's high blood pressure and kidney disease. They're going to lead to you having, kidney failure, needing a transplant, or that's going to lead to you having a heart attack, or that, so there's all these things that we know are going to happen. So, it was that was trying to prevent that was really
Mm-hmm.
sort of the goal.
And I love when you talk about having the time to really explain what's going on, because I remember, and for people who are just joining and not familiar with who I am, I've had Crohn's disease for 23 years. And so when I started the Scene Society to explore the intersection of leadership and inclusive work environments for people with chronic and invisible illnesses. And so when I think about my diagnosis journey and being, so young, I was 12 when I was diagnosed. And I remember the doctor had this like diagram of your stomach, right? And he was showing me what was going on, but I'm 12, it didn't click. My mom is freaking out because someone just told her daughter has an incurable disease. And
Mm-hmm.
we got pamphlets. In the pamphlets, there was no diversity. There was no more explanation. And so I finally had a really good doctor who drew out all these pieces for me and then like explained what was happening in my stomach and then explained, and we give you this medicine, but these are the things that you're going to have to work with to control to help the medicine work better.
Yep.
And I think up until that happened, and I was in young adulthood at that point, like I took medicine to just, I'm gonna take my medicine, I'm gonna take my medicine, but I didn't really think of my day-to-day lifestyle as medicine,
Yep.
and as things that were actually more important than the medicine that could either help or hinder what the medicine was doing.
Yep.
And so when it comes to weight loss, now that I'm healthy, I'm like, oh, I actually can gain weight, and it's there. And so what are some of the common beliefs and misconceptions about GI care and about weight loss in our community that you hear a lot? that you would love to like quickly dispel or
Yeah.
introduce something? I know we don't have a whole bunch of time, so I
But
know you have a lot.
I could go on forever. So I'll start with GI care. And the biggest misconception is that if I feel fine, that I don't need to have age appropriate colon cancer screening, or, oh, I think nobody in my family said anything, so there must not be a family history. So one big thing I wish patients would do, but that we should all do, is talk to your family. So if you have a history of polyps or a history of cancer of any type, your family needs to know. We don't need to keep these things private because that increases their risk. And I need to know. When I ask, it's a reason that we ask patients, do you have a family history? Because it changes when you need to be screened. So that's number one, talking to one another. It also changes sort of my thoughts. If I know that you have a cousin and a sister that has Crohn's disease, it's going to increase my thoughts on maybe your diarrhea is not just because you're eating whatever. Maybe we need to do a colonoscopy sooner on you. Maybe we need to do these things sooner versus, a 20-year-old that's just eating greasy pizza all the time. You know what I mean? When you have a family history, it makes us think about certain things a little bit sooner in the algorithm. So that's one thing. Another thing is that, you feel different after a colonoscopy. You do not feel different after a colonoscopy. So that's another misconception why people don't want to have it done. You wake up feeling like you had the best nap ever and you go home. That's it. So those are things about, I'll take it a bit brief about GI health. You have to get screened for colon cancer. If you feel it, it is to the point where it's too bad. It's bad at that point. You don't feel a polyp, and that's when we want to take it out so it does not turn into cancer. And you don't feel that either. So that's one thing. And then the other question was GI care and weight loss. Okay. So, I think for maintaining weight and weight management, I think the biggest misconception is you have to do some of these drastic things you see online. You have to cut out entire, macronutrients. You can't ever eat, it's like all of these things that you're like, no, you can't eat fat ever. Well, actually, your body does need some fat, or you can't ever eat carbs. So actually, your body does turn those carbs into glucose, which your brain and your heart needs to function. So it's showing patients the difference. But also, lentils are not the same thing as French fries, So it's giving people some practical things that can be done daily to show them how to maintain weight and how to prepare food. How to purchase food, how to look at food labels, how to think about things in a way that are sustainable, so they don't feel all of these fad diets. People will say, oh yeah, it worked, but then I couldn't do it anymore, so I stopped, and that's the late regain weight. Of course you can't. So the goal is finding things that are sustainable, things that you can do your entire life, things you can do when you travel, things you can do when you go to restaurants. It does not have to be difficult. And I think it's taking that mystique away, taking that idea that it has to be that exercise or just movement has to be some aggressive thing. Too, people think, oh, if I can't do an hour, it's worthless, or if I can't go to CrossFit, it's worthless. And that's not it. Getting people to move more throughout your day, natural movement is important. And it's this low-hanging fruit, those small things that you were talking about that your doctor probably told you create overall good health. So sleep. People don't get enough sleep. They're up on their phones. They're on social media. They're doing all these things. Getting people to have enough water. Those are important. Things that are stress reducing. So yoga, meditation, journaling, being around friends and family. I know we're all stressed from like work and how fast paced life is, but taking that little bit of time to say, you know what, no matter what, this is going to be my downtime. So those are like things that people don't think are a large part of their journey, but they really are. And my patients notice it. I love when they start to really, really see that, wow, this week I've been eating the same, but my sleep has been off and I've been more stressed because of work and I haven't really drank enough water. And this week I plateaued in my weight. So they're like, that's insane. They're like, I did everything else the same. I'm like, yes, so I love when people see that connection of how important it is. So those are some small things, and patients are shocked. That's the first thing we're starting with during visits. We have to do those things first, right? And so it's really getting people into those habits and showing them how to keep those habits so they can create. And the goal is just sort of getting to a point where you create habits that you're able to stick with.
Yes. So I love that you mentioned sleep, because people often don't, like when we think about weight loss, when I've thought about it, I've thought about everything I'm eating, drinking water, and then, but then I'm like, I don't factor in sleep.
Nope.
Or even when you think about your overall general health and you're like, oh, this is how productive I am, this is how good I feel. And people a lot of time don't think about sleep. And so I'm glad that you said how important sleep is, and especially for people in the autoimmune in the illness community, in the GI illness community, like sleep is one of the most, sleep and rest and de-stressing are like the top three
Huge.
things that, you know, can really make a difference in how we feel. So you touched on colorectal cancer, and I'm so glad you did, because this is Colorectal Cancer Awareness Month. And one of the things I was surprised to learn was that while that a lot of times Black, Indigenous people of color, like all of the marginalized communities, oftentimes get a later diagnosis, and that colorectal cancer does not have to be fatal, but a lot of times due to us being diagnosed later, putting off care, or not knowing the signs, we end up getting diagnosed later, and then it often is more fatal for us at a higher rate. And so I know you talked about speaking about family history, and I just wanted to put a plug in there, is that like for me, finding out, I didn't find out that I had a history of Crohn's and colorectal cancer in my family until I was diagnosed with Crohn's. And so I found I had a grandparent that passed from colon
Wow.
cancer. I had an aunt that had colon cancer. My father has Crohn's disease. And so
Wow.
there were a lot of these things that I didn't find out in my family until after I was diagnosed. Now,
Mm.
because I was diagnosed so young, I was able to make a good choice. So that's a big factor in why having Crohn's disease, and then I chose to get an ostomy, because I knew I already had these very high factors to get colon cancer. But had no one in my family talked about that, I would not have been able to have an as informed choice.
Yeah.
And so I just wanted to take this time for anyone who's watching now or who watches the replay to really, really, really drill in that family history is important, and that we cannot let our secrets kill
Yeah.
us. And that these things shouldn't be a secret. Like, you need your community and a community to get through whatever you're going through health wise. And so please don't keep what you know about someone who may have passed away, or what you know about yourself or other people in your family, a secret. If you know people are talking about symptoms or going to the doctor, please make sure that you share what you know, so that people can get the proper diagnosis and have a fighting chance if one of these types of illnesses comes up.
Yeah. Yeah.
So I just wanted to take the time to share my personal story with that, and how I feel like my family education helped save my life and increase my quality of life now. So yeah. So back on to just the last part of this. What is your advice for anybody? You've talked about how you like reapproached healthcare. You talked about feeling in this space where you didn't feel like you fit, and then you created gut theory. You talked about some of the things and misconceptions that people in our community come in with about GI health and weight loss. So to someone who may be starting a business, or who may be a medical student, or who's thinking about switching a career and is feeling like, I don't fit anywhere, will anyone really like this? I know we all have that in our back of our head, like, is anyone going to really like this, or respond to this? What is your advice for them? Like, what would be your advice to your former self, thinking about all of these things you're doing now and feeling a little
Yeah.
uneasy or out of place?
I say that is normal. And Lee, I would, remind myself that of course, that is absolutely normal. You're going off of the beaten path, right? But one thing I reminded myself about as I would drive around the city is that there had to be somebody to create all of these businesses. Every single place I went into every day, somebody had to have the guts to start that. And so that was one of the things that sort of kept me going, is to say, you know what, if everybody felt that no one wanted their thing, no one would start anything. And so I say keep going. Lean into there is an audience for it. So lean into it. Do your research. I found inspiration sort of everywhere, and I got advice from everywhere. Any business owner, I listened and I soaked it up. My hairstylist, I will never, like, she gave me advice because she has been a business owner for over 20 years, and people like, your hair. I'm like, yep. some of my biggest advice came from her. You know what I mean? And so just listening to everyone, paying attention, and being one hard thing for me is being a type A person, and people in medicine will get this, is when you have a plan and you write it all out, you want that plan to work exactly how it's written out and how you have it in your brain. And that doesn't work all the time in business ownership. So I had to be okay with pivoting, and that not cause me anxiety every single time I had to do it. So I think being okay with change, being okay to fail, and not think the world is over when one thing didn't work out the way you thought it would, because there's something else around the corner that's better. So leaning into every experience, and I think, yeah, just showing up and doing whatever you feel like is sort of where you're supposed to be. So
Thank you. You said so many things that resonated with me because I'm type A. I'm not in the medical industry, but I'm very type A, overcoming perfectionism. And
yep,
so those are things I always have to remind myself of as well. So before we leave, because I know our time goes so fast, if
I know.
anyone watching has a question or a comment, feel free to drop those in. We can try to get one or two in before we jump off. But tell people about Gut Theory, how they can find you, how they can connect with you. And for everyone watching, Dr. Like, she is amazing, and her spirit just lights up and follows her whenever you meet her in person. And so I just am so excited to see everything that you continue to do. So
That's so
tell people
sweet.
where they can find you.
I am located in Washington, D.C. I'm in DuPont Circle. Online, our website is guttheoryhealth.com. And email is info@guttheoryhealth.com. I do a lot of telehealth visits, especially for patients that live in places. I'm licensed in a couple of places outside of DC as well. So New York and Maine and Illinois, California, Georgia, of course, Maryland and Virginia. I think that's it. So not North Carolina yet. Sorry.
No, I'm
I
waiting.
know. So I have a lot of patients that come in from other places for their initial visit, and then we do telehealth after that. So yeah, that's me, and yeah, it's super. We have a good time in the office. Yeah, it's fun.
Yes. And there is one question in the comments that says, as a medical student, how can we begin to enter this space? I have similar passions and would love to find a mentor in this space as well. And that is from Garvin's12, who is in the comments.
Oh, okay. So first, I would say, as a medical student, it depends on where you are, but I think whatever city you're in, but I think and it sounds crazy, but one place where sort of it's easy to find a bunch of people and to figure out where whoever somebody in this space is in your city is Twitter, crazy enough, or whatever it's called now, X. But it's like med Twitter or GI Twitter. You'll see these hashtags, and you see when people post about sort of research they're doing at their universities. And they're always looking for students that want to be involved in sort of research. So that is, I think, a really, really good place to start. You get to see who's active in research in obesity, in nutrition, in GI. And that's really a really good place to start. And everybody, it's a super approachable place too, because people just like comment and they respond and it's easy. And I wish it was around when I was a student, because otherwise I used to just go to conferences and be afraid to talk to attendings. So I've met so many residents and fellows and from Twitter. Which I think otherwise they probably would never have said a word, you know what I mean? So, and then going to conferences. So Digestive Disease Week is coming up in a few weeks in DC. Then there's Obesity Medicine, Obesity Medicine Association. There is Obesity Week. So there's so many medical conferences, but on Twitter is a really good space because people are posting about conferences that are coming up all the time. So I think that's a really good place to start.
Thank you. And I know we're at time. And before we leave, I just want to tell everyone, thank you for jumping on. I want to thank you for being our guest, for sharing
Thank
your
you.
story of inspiration, and for the work you do. Like I said, as a patient, like knowing that there are doctors and physicians out there like you who are so committed to overall wellness and education and prevention, and who really see us, it is, I can't even put into words how valuable it is, because you are really saving people's lives. And so I appreciate that, and I appreciate you. coming on and taking the time today. For anyone watching this who is in the chronic illness community, if you have a gastrointestinal illness and you want to find community, you need help getting in contact with resources, I am an ambassador for Color of Gastrointestinal Illnesses, which is a nonprofit that is dedicated to increasing diversity in research, access and equity in health and education around GI issues for people in the BIPOC community. So please connect with me, or you can look up Color of GI on Instagram, also known as Koji. And so please look that up. You can connect with me and we can get you in community so that you can start healing and just finding a place to connect and finding support. So thank you all for jumping on. Thank you. I hope you have a beautiful rest of your weekend, and we'll see you next time.
Bye, guys. Thank you for having me. Have a good one.
Bye.
Bye.